I'd first like to introduce Walter Donaldson, who is the co-chair of the Friends of Ajax-Pickering Hospital. So would you please welcome Walter?
Watch yours. Sorry. That's all right.
Well, good afternoon. It's good to see a good turnout like this. First of all, let me preface by saying, if there's anybody here from Centenary Hospital, please don't take this to heart. Don't take it personally. I'm here representing the Friends of the Ajax-Pickering Hospital, not the Friends of the Rouge Valley Health System Ajax-Pickering Hospital. I was a patient in Centenary for about 3 weeks a few years ago. Excellent care from Dr. Gladstone and everybody in the cardiac care unit. If it wasn't for them, I wouldn't be here today. So let's just say that I think our first problem started back in when we were talking about the restructuring in 1998 with the forced amalgamation of the Ajax-Pickering Hospital with Centenary Hospital in Scarborough. At the same time, they closed the Whitby Hospital, which didn't please too many people in Whitby. A more natural choice would have been to amalgamate Ajax and Whitby, but it wasn't. The ironic thing is that, at that time, is that the two most powerful ministers in the cabinet at the time both represented Ajax-Pickering and Whitby. Slowly, it was noticed that a clinical services plan was being developed for the Rouge Valley Health System. But in this clinical services plan, it looked like there were more services moving west than staying where we were. So a bunch of citizens got together. Some of them took up a petition, which they got over 12,000 citizens, presented it to the legislature. But as usual, petitions just sort of get presented and then fade away. So we better keep an eye on things. So we started having people attend all the board meetings, and when I'm saying board meetings, I mean B-O-R-E-D meetings. They are awful. But somebody has to do it. There are many hospital systems apparently that do not allow the public into their board meetings, but we're lucky enough that we can. We don't get to hear too much because a lot of the business takes care in camera after the public is gone. Anyway, we kept up that. We decided that people had to know what was going on in the community. So we put together 3 little public presentations. We presented one in Pickering, one in Ajax, and one in Whitby. Politicians and citizens came out and listened to what we had to say, and we were warning them about what was happening down with transferring and consolidation of services. At the last meeting we had in Whitby, which was one of our best attended ones, one of the doctors came in and announced that obstetrics was closing at the Ajax-Pickering Hospital. Supposedly it was going to be temporary to cover over a Christmas season. We didn't believe them, for good reason. We called together the public. In about a week, we put up posters in clinics, in daycare centers, everywhere we could. According to town staff in Ajax, 1,200 people showed up at the Civic Center, and there was probably another 300 that couldn't get in. They all voiced their displeasure. There was no way that they were going to let this pass. There were several doctors and nurses at the meeting who publicly stated that if the transfers went ahead, they would not be returning if the services came back to Ajax. That would have left it, what are you going to do? Well, we can't have a department if there's no staff. So that would have had it closed. Somehow they were able to overturn that decision, and with the help of the regional council, who had already promised about over $3 million for the expansion, regional council decided, until they were satisfied that obstetrics were going to stay permanently in Ajax, they would withhold that $3 million. That helped big time. A few months later, regional council came to the Friends, not that we had anything to do with releasing the money, but they asked us if we thought it was okay that things were back to normal. We said yes, so the money was released. And that was it for now. Then, along comes the Lynn. And they're not much friends of ours either anymore. We met with them, actually we met with Foster Loves even before he had an office and a chair to sit in. And we told him what we expected, what the citizens of Durham wanted, would like. Well, then along comes this announcement back in May that 20 hospital beds were going to be moved out of, 20 mental health beds were going to be moved out of Ajax-Pickering to Centenary. Not only that, the 9 extra mental health beds that were included in the expansion that is going on now, they weren't going to be built either. Well, again, here we go. We fired off a letter to the LHIN and the board saying that in your own documentation, you say that services will not be moved without consultation. Okay, so they threw open a meeting. About 1,200 people showed up again, everyone against it. We were basically told that, yes, we're consulting with you, but we're still going to move the services anyway. And that's where it sits now. The 20 mental health beds are gone. Major renovations were done to the mental health ward in the Ajax Hospital. They went ahead even after they decided to move. And if you want to see some pictures of a lovely mental health ward that's not being used, go to the Ajax-Pickering website, Friends of Ajax-Pickering.com. We had somebody go in and take some pictures. They're all there, but there's no patients. Now they want to convert those to medical beds, if they can get the money from the LHIN. What does that mean? It means they're going to have to tear them all down and rebuild them to student medical beds. This is what's happening with our tax dollars. Once again, we went to regional council. Okay. Once again, we went to regional council, and as they had not fully committed to the $3 million that they said they would give the hospital for expansion, we requested that they withhold the money again. This seems to be the only way you get the attention. This was in May. Regional council didn't have enough votes in May to go ahead with it, so they put it off until September. So the hospital board and the LHIN had to sweat all summer because they didn't know if they were going to get this other $1.7 million that was waiting. In the fall, regional council met again, and after much debate, did release the money. So we took that one as a loss. But at least it got their attention. So the only thing I could say is what we've been doing is keeping the politicians, mainly the local politicians, the local MPPs, they don't really seem to care, but the local politicians, we keep them informed, we keep the public informed. We attend all board meetings, we get people to go there, we go to the LHIN meetings. We try to let people know through our website what is going on. If there's something that needs red flag, we scream. And that's about the only thing to do. And the other thing is keep a paper trail of everything. My predecessor in this job, Bill Parrish, was a folder, I think this big, in his basement, of letters we have sent back and forth. And he can account for every letter back and forth we sent. Thank you.